Hello everyone, I am Dr.Manisha.Kakade, your consultant, obstetrician, gynecologist and fertility expert, and I am into private practice since 20 years and I am consultant at Anantshree New Spring Fertility and IVF Center, Aurangabad. On the occasion of the breastfeeding week, I have come up with this informative video on breastfeeding, and I really hope that this video is beneficial for all the lactating mothers. Now, a newborn baby has only three demands. They are warmth in the arms of the mother, food from her breast, and security in her presence. And breastfeeding satisfies all three. And the benefits of breastfeeding to the mother are that it gives an excellent opportunity to bond with your baby. Breastfeeding also prevents excessive uterine bleeding that might occur after the delivery. Breastfeeding also reduces the chances and risks of ovarian and breast cancer. It saves a lot of time which is required to sterilize and prepare for the formula milk. Hence, it is also good and readily available for the baby anytime the baby demands. This also is very economical as it saves a lot of money that is required for the formula milk. To an extent, it is a natural family planning method or measure that gives safety to the mother. Then let us check out the benefits of breastfeeding to the baby. And breast milk is very essential for the optimal physical, emotional and mental development of the baby. Breast milk is a complete nutrition that fulfills the demands of the baby and also its nutritional requirement throughout the day. It provides immunity, lifelong immunity to the baby, thereby reducing the chances of infections to the baby. It also protects the baby from different allergies and asthmas. Tips of breastfeeding tips while doing the breastfeeding. Now, get the baby's mouth near to the nipple so that this stimulates to open the mouth of the baby wider. And now, latch the baby to the breasts. Now, what is proper latch on? How do you understand that the baby is properly latched on? So the signs are mouth should be wider open, chin should be touching the breast, and the nose should be free to breathe. This is a very important point. Otherwise, the baby will not be able to comfortably take the feeds. Then cheeks should look a little blown up or flatulated. Then you should be able to hear the baby suck and swallow, and the lips should be flanged out. And there is also one more thing, that is the nipples look long and rounded after every breastfeed. So these are the signs which will tell you that the baby was properly latched and the baby has taken good amount of milk comfortably. Now, while delatching also, it might cause a pain to the mother if the baby is pulled out directly. So to avoid that pain, I will give you one tip, that is use your little finger to press over the gums of the baby so that the baby opens the mouth and it becomes very easy to delatch the baby. Now I would like to talk about the nutrition of the mother. So in nutrition, I would advise that she should take 300 to 500 kilocalories more to what she was taking previously, which was advised during her pre-pregnancy state. Now this much is as it is the requirement, daily increased requirement of the mother to support the lactation. Now, I would also advise her to go and check with her doctors if any kind of supplements are also to be added depending on her condition. Like if the iron requisition is less, then we have to add the iron. And lactating mothers should be taking calcium preparations, as all the calcium that is stored in her body will be given to the baby through the milk, and she will become slowly deficit of calcium. So to fulfill her need and the baby's need, she should be taking good preparation of a calcium in an adequate amount till the time she is lactating. Then I would advise her to take or include all the nutritious things into her diet and variety of things into her diet, not restricting anything, but nutritious food is the answer. Then she should be taking adequate amount of water or fluids like juices and milk also, to keep the lactational milk flow to the baby adequate and proper. Then she is also advised to restrict the caffeine intake. That is, only 1 or 2 cups of coffee is allowed, but if possible she should restrict that as well. And alcohol has to be completely restricted. Then another thing I would like to add is that all the lactating mothers who are working or who have to resume their work should take care that they refrigerate the milk, express the milk and refrigerate it, and then after refrigerating, the milk should be thawed before using. You have to thaw. This thawing procedure has to be carried out. That is, this milk has to be warmed into a double boiler by using the double boiler technique. That is, keep water in one utensil, heat it on the gas, and then on that you should keep another utensil which is containing the milk, and with this double boiler technique the milk should be warmed up, and as soon as the milk is warmed, the milk should be given to the baby, or else it should be discarded. So you can only use this milk for 24 hours once it is expressed, freezed, and once it is been thawed. So this is the technique, so that the working women who are not able to come home and feed their babies, they can use this technique for giving it to the baby. Then I would say that this breastfeeding is an empowering feeling to a mother. It is an accomplishment that takes dedication, and every mother possesses it. And all the mothers would rather agree with me that there is nothing better than the time spent nourishing her child. And it is not just about the milk, but it is also about the purest unconditional love that the mother possesses for her child. And here I support breastfeeding and appeal to all the mothers to feed their babies as frequently as possible as the babies demand. How long to feed the baby? This is a very frequently asked question by the mothers, and here I would like to tell them that when the baby is born, the stomach size is also very small, and here you will have to keep on feeding the baby very frequently, say 2 hours to 3 hours throughout the day. That is, around 12 to 14 feeds in entire 24 hours will be required. And to every breast, the baby should be put, say, around 5 to 10 minutes. Then, as the baby grows a little older, that is beyond 1 month, up to 6 months, the baby will take the feed from each breast, say around 20 to 40 minutes. And the frequency will be like around 8 to 10 feeds per day. That is 3 to 4 hours will be the duration of the gap. Then after 6 months of age, baby will be starting some weaning and top feeds. So these babies will take only 3 to 4 feeds per day but the timing will be same, that is 20 to 40 minutes per breast will be the feeding time. And after that, I would also like to add one more important thing, and that is burping. The baby should be burped after each and every feed, right from the time the baby is born till the time you are feeding the baby, because of the breathing pattern is aerophagic. So while taking the feeds, the baby will be swallowing a lot of air inside, which will give rise to a big air bubble inside the stomach. And this air bubble, if comes out accidentally and the baby is in a lying position, there are chances of baby aspirating it. That means the nasal passages might also get blocked. So this might give rise to a very serious condition. Hence, this air bubble has to be taken out every time the baby takes the feed. So you should hold the baby in the upright position on your shoulders and pat the baby's back or gently rub the back in order to get the baby burp. So while burping, sometimes the baby just with this air bubble might vomit small amount of milk, but that is not to worry. If it is very small, then it's okay. It's not going to cause any harm. But burping the baby is a very important step while you feed the baby. Now let us see few signs that would make us understand that the baby is getting enough feeds. So amongst these signs, the baby feels content for at least 2 to 3 hours. The baby will be calm and will sleep. This is one main sign that the baby is satisfied and contained. Then the baby will pass clear and diluted urine every 5 to 6 times in a day. That is also another important sign. Then the baby will pass 6 to 8 times yellowish, watery, golden color stools while the baby is in the life of first 2 weeks. That is, newborn baby in first 2 weeks will be having this pattern of the stools, and this might cause some weight loss also to the baby. But after 2 weeks of life, the baby should start gaining the weight, and by the time the baby becomes 3 months old, the baby's birth weight should be doubled up. So these were the signs to understand that the baby is taking sufficient amount of milk. Then we will see what are the measures to increase the milk supply. There is only one great good measure to increase the milk supply, and that is the baby should be frequently put to the breast. As frequently the breasts get empty, the milk production will be that frequent and that intensely increased. Now, hence we can also say that the baby should be fed as per the demand. So this is called as demand feeding. This is also a very important part. Then let me talk about few complications of feeding or during the lactational period that the mother encounters. First is like she might feel a little breast pain due to engorgement and more amount of milk production. So in that case, I would advise her to wear tight breast supports, and plus breast pumps can be used to express some amount of milk if it is very much more. Then after that, we can say that there are conditions like baby biting the nipples becoming sore, or cracked nipples. So these are also another conditions. In that case, you will have to go and check with your gynecologist so that they will examine you and give you some local application creams which will take care of this condition. Then there is mastitis and breast abscess. This is a little more serious condition, and this also has to be consulted with your gynecologist, in which they will examine, give you some medicines. If it is not cleared by the medicines, then Sometimes some interventions like draining this abscess and all can be recommended.